Tuesday at the state capitol, lawmakers met for the fifth time to talk about Oregon's addiction and public safety crisis ahead of the February session. The attendance alone showed just how pressing these issues are.
I'm going to remind everybody it's an ongoing process.
The Joint Committee on Addiction and Community Safety Response formed in September. The bipartisan group, co-chaired by Senator Kate Lieber, is now revealing a controversial proposal that would end parts of Measure 110 and recriminalize possession of illegal drugs like fentanyl.
With fentanyl, it is killing people, and we need to make sure that we continue to prevent that.
They're also looking to expand treatment options, break down barriers drug users face when seeking residential care, and increase the amount of time a sobering or treatment facility can hold someone who's intoxicated.
And I believe this helps take immediate action to some of the problems we're seeing now, and is a better path than what we were doing previously.
As for public safety, the proposal changes Oregon law to make it easier to prosecute drug dealers. It ups the penalties for drug dealing within a public park, near homeless shelters and treatment centers, and increases funding for treatment and staff recruiting. Some groups, like the ACLU of Oregon, see this as a step in the wrong direction.
This reflects a massive failure of leadership.
A failure? Interesting. Okay.
And they are not working on real solutions. They are working on failed policies of the war on drugs, which we know don't solve addiction or homelessness.
Look, I don't think that we should criminalize addiction. Like, I'm not, this is not my, if I'm going to lead with the values here, but we've got to have all the tools in our tool belt to address what's happening on the streets in Oregon, right? And we did remove a tool, and we are simply giving that tool back to the police.
Addiction is a healthcare issue. It is not a criminal issue.
Now, Republicans who also sit on this committee pushed back on many of these proposed policies. They argued the timeline doesn't reflect enough urgency. Now, last week, House Republicans proposed a similar bill, but their focus is ending Measure 110 and offering treatment instead of jail time. I also want to point out here that many of these proposed policies talk of refining the inner workings at treatment centers and sobering centers, but let's step back here. Oregon doesn't even have enough of these centers as it is. And building more, we're told, will take time. But on a more immediate note here, the governor is expected to declare a fentanyl emergency in Portland any day now. David?
Yeah, the conversation continues. Blair Best in Salem tonight. I appreciate that perspective.